So I think declining reimbursement is the first negative. I think the second one is more lower and more select utilization. And David King spoke to this in his address, and we have seen it, is the advent of health plans with higher copays and deductibles has led to more prudent utilization of laboratory services by both patients and doctors. The patients ask the doctor, do I really need this test? I have a $1,000 deductible. The doctor is more aware of that. So the more, and we see this everywhere in healthcare, the more a patient has to pay out of pocket, the lower the utilization, or the more selective it is. The other thing we're seeing is more practice modalities of how to treat certain diseases. We saw the reduction in the number of pap smears or the frequency, PSA testing being questioned. There are a lot of initiatives out there to say some testing isn't as necessary. So between the pricing of patients having to pay out of pocket and what's going on with other factors impacting utilization, we have a downward swing or trend on utilization in addition to pricing. And then we have the whole ambiguity we're dealing with here of how is laboratory going to be paid in the future? Is it going to be a bundled payment? Is it going to continue to be fee for service? And I think the other problem for non-hospital players in the market is the continual acquisition of practices and the affiliation of those practices in health centers, which are consolidating further. So the market for the poor lab out there competing is, there's a lot of negative things going on in terms of the general dynamics of the business.